Hello everyone, this is the Health Minister of Senegal. Today I'm going to present our midwifery personnel training program. To achieve SDG 3 good health and well-being, Target 3.1 calls on states to reduce the maternal mortality ratio, the MMR, to less than 70 maternal deaths per 100,000 live births by 2030. In Senegal, however, the situation now is not satisfactory. Despite the remarkable progress we made in the past 2 decades, the MMR in 2020, which is 261 maternal deaths per 100,000 live births, is still significantly higher than the world average and far away from the SDG requirement. The reason behind this is the low proportion of births attended by skilled health personnel. In 2019, only 75% of births in Senegal were attended by skilled health personnel, which means a quarter of mothers did not receive adequate medical care. This exposed them to possibly fatal risk factors such as severe bleeding and infections. The root of this problem lies in the shortage of midwives. Here in Graph 2, we can see the density of nursing and midwifery personnel in Senegal from 2015 until now, as well as the projection up to 2030 and the confidence intervals. Meanwhile, the blue line at the top is the WHO recommendation. According to WHO, to provide adequate medical services, at least 2.5 medical staff per 1,000 people are needed. But in Senegal, the number is only 0.44. As shown in Graph 2, if we maintain the current growth rate, even by the most optimistic estimates, Senegal will not be able to reach the recommended value by 2030. Therefore, the Ministry of Health has decided to launch a program to train more nurses and midwives. By calculation, the current total shortage is approximately 36,000. Referring to the forecast in Graph 2, it is expected that by 2030 there will be 6,000 additional nurses and midwives. So to fulfill the remaining gap of about 30,000, the program will fund the training of an additional 5,000 midwifery personnel each year for the next 6 years. The total cost of a 3-year midwife training course is about $4,500, and the cost per year would be $22.5 million in total. Funding for the program will come from an increase in tax revenues. We will increase the tobacco tax rate from the current 65% to the WHO recommended 75%. The tax increase plan has been approved by the Ministry of Economics. We believe that this program will effectively reduce maternal death and contribute to the reproductive health for all women in Senegal. Thank you for your listening.